Hi, I'm Jeff Ulmer, licensed clinical professional counselor from Success Development Services. Over the years, I've noticed that a lot of people have a lot of confusion about the different types of mental health practitioners there are out there. There are a lot of people who are mental health professionals who have various specialties that help people with mental illness in very specific ways. I'm going to spend some time on this tape today talking about the different types of professionals and how they help different people. Let's start by talking about the psychiatrist. A psychiatrist is a medical doctor, an MD, who specializes in treating mental illness with modern medicine. The kind of modern medicine he practices most is using psychiatric medications. Now, one thing that's been found about mental illness over the years is that many mental illnesses correspond with chemical imbalances in the brain. Now, because of this, the modern medical industry has done very well in developing new medical treatments for mental illness that treat mental illness by changing the chemical balance in the brain. It changes what chemicals are produced in certain ways, it suppresses some, it encourages others, and through this process they can change the way a person's brain makes the chemicals that make it think the way it does. This has been a very, very helpful treatment in treating many types of mental illness. Now, when a person sees a psychiatrist for the first time, the psychiatrist will make decisions about what kind of medications they're going to get based on symptoms. But also other things are taken into consideration. Things about the person's size, their gender, allergies with other medications they're currently taking, and all these kind of things will play into what decisions the psychiatrist makes about what is the appropriate medication for that person. But it's not a one-time thing. A person will have to come back time and time again, and a psychiatrist will make decisions about changing a person's prescription based on how they're coming along. A lot of these medications don't just take effect overnight. They're not like an aspirin where you take them and you get better a half an hour later. The fact of the matter is many of these medications are very serious stuff that take several weeks to build up in the person's body. A lot of times when a person starts taking medication, they won't really notice the real effects of what that medication does for 3 or 4 weeks into the process. So, once time has gone by, the psychiatrist will do another assessment and will sometimes change the medication, upping the dosage, decreasing the dosage, changing medications altogether, so that the person gets the best medical treatment they can. Next, let's talk about a neurologist. A neurologist is a medical doctor that specializes in the central nervous system. Now, the central nervous system can have all kinds of problems. There can be developmental problems, there can be viruses in the brain, there can be brain damage and brain trauma, there can be tumors, there can be aneurysms. There's a number of problems that can happen to the brain that can cause symptoms that are very similar to symptoms that we see in mental illness. Cognitive distortions, perceptual problems, emotional problems. Now, because of this, a neurologist is often called upon to separate things out for us. When we have somebody who we're not sure if they're having a psychological issue or a chemical imbalance or something more profoundly wrong with a person's brain, we use a neurologist as a referral to make sure everything's okay. And if it's not okay, the neurologist is the best person to be treating them anyhow. Next, let's talk about a psychologist. A psychologist is a doctor, but they're not an MD, they're a PhD. A psychologist is a scholar. Psychologists specialize in doing research and other academic things like teaching at universities. They're the ones that help make other psychotherapists and other mental health practitioners. Now, they do have expertise in doing talking therapy and working with clients on mental health issues. But where a psychologist is really expert is at doing psychological testing. Generally speaking, psychiatrists, psychotherapists, counselors, what have you, will send people to a psychologist when they have questions about what's really going on with this person. IQ testing and other types of testing for mental illness, this is the kind of thing that a psychologist specializes in. Next, let's talk about the psychotherapist. A psychotherapist is a mental health practitioner who specializes in helping people deal with psychological problems or mental illnesses using talking therapy. Talking therapy is just that. It's no medications, no surgeries, nothing weird like that. It's two people sitting in a room talking. Generally, the psychotherapist is very skilled at talking to a client who's having trouble and helping them work through things and see things from a different perspective and gain insight. Generally, we ask a lot of probing questions. We ask very open-ended questions. We encourage our clients to think about things that they haven't thought about before. We encourage clients to look at things from perspectives they haven't looked at before. We do psychoeducational work where we teach clients things that they might not have known before. We give them insight as to how the mind works, why people think things they do things they do, act the way they act. We help people to examine more closely what they're doing and what they're getting as a result. We help people to strategize and plan and to think of better ways to do the things that they're doing, or to change the way they're doing things altogether and approach things from a new way and get better results for themselves. Next, let's talk about counselors. The word counselor is very complicated because it means different things to different people, even in the mental health professions. The fact of the matter is that the word counselor is used differently in different places because of different legal statutes. In some places, the word counselor is interchangeable with therapist or psychotherapist. In other places, it's not. The word counselor can be used by all kinds of different people. I'm sure that you've heard of credit counselors, or academic counselors, or marriage and family counselors, or drug counselors, or domestic violence counselors. The fact of the matter is that all these different types of counselors have different certifications in different places, and they're not the same all over, and it's really hard to tell who you're talking to when you're talking to a counselor. The best way to be sure is to be kind of familiar with local laws or the local mental health process. The best way to do that is even ask them, what is it when you say that you're a counselor? What is it that you do? What are your certifications? What are your trainings? What are your licensures? Now, in some places, counselors are very, very well trained, very well certified, very highly licensed. In other places, just about anybody can call themselves a counselor. So there's a lot of discrepancy, and you want to be careful when you're dealing with somebody who says that they're a counselor.